Did you know your mouth is a window to your overall health? It's true. Most of us think brushing and flossing is just about preventing cavities and bad breath. But what if I told you that neglecting your teeth could lead to serious problems in your heart, your brain, and even your lungs? Today, we're diving deep into the surprising and sometimes shocking ways your oral health is connected to the rest of your body. And trust me, by the end of this video, you'll never look at your toothbrush the same way again. Let's start with the basics. Your mouth is teeming with bacteria, billions of them. Most are harmless, but when you skip brushing or flossing, the bad guys start to take over. They form a sticky film called plaque. If that plaque isn't removed, it hardens into tartar, which irritates your gums. This is the first stage of gum disease, called gingivitis. Your gums might look red, swollen, and they might bleed when you brush. Now, this is where things get serious. If left untreated, gingivitis can advance to a more severe form of gum disease, called periodontitis. This is where the real trouble begins. In periodontitis, the inflammation goes deeper. The gums pull away from the teeth, creating little pockets that get infected. Your body's immune system goes into overdrive to fight the bacteria, and this constant state of inflammation doesn't just stay in your mouth. Think of it like this. Your gums are full of blood vessels. When they're inflamed and infected, it creates an open gateway for harmful bacteria to enter your bloodstream. From there, these bacteria can travel to literally any part of your body and cause chaos. And the number one target? Your heart. Numerous studies have shown a strong link between periodontitis and cardiovascular disease. Here's how it happens. The bacteria from your mouth can travel to the arteries in your heart and contribute to atherosclerosis, which is the hardening and narrowing of the arteries. This inflammation can also lead to the formation of blood clots. A blood clot can block blood flow to the heart, causing a heart attack, or travel to the brain and cause a stroke. It's a scary thought, isn't it? The same bacteria that cause puffy gums could be a contributing factor to a life-threatening heart condition. But the heart isn't the only organ at risk. Let's talk about your lungs. If you have gum disease, you're constantly inhaling bacteria from your infected mouth. For most healthy people, this isn't a huge issue. But for older adults or people with compromised immune systems, these bacteria can be aspirated into the lungs and cause serious respiratory infections like pneumonia. Researchers have found oral bacteria in the lung tissue of patients with pneumonia, proving that a direct link exists. So, keeping your mouth clean is literally a breath of fresh air for your lungs. Now let's move on to another critical organ, your brain. Emerging research is pointing towards a terrifying connection between gum disease and cognitive decline, including an increased risk for Alzheimer's disease. One theory is that the chronic inflammation from periodontitis can spread to the brain. This neuroinflammation is a known factor in the development of Alzheimer's. In fact, scientists have even found the specific bacteria responsible for gum disease, Porphyromonas gingivalis, in the brains of deceased Alzheimer's patients. This doesn't mean gum disease causes Alzheimer's, but it strongly suggests it could be a significant risk factor. It really makes you think about how interconnected our bodies truly are. The connections don't stop there. Let's talk about diabetes. This one is a two-way street. People with diabetes are more susceptible to infections, including gum disease. High blood sugar levels create the perfect environment for bacteria to thrive, but it also works the other way. Having severe gum disease can actually make it harder to control your blood sugar. The chronic inflammation from periodontitis can make your body more resistant to insulin, the hormone that regulates blood sugar. It's a vicious cycle. Diabetes makes gum disease worse, and gum disease makes diabetes harder to manage. This is why dental care is an absolutely essential part of managing diabetes. Even pregnancy isn't immune to the effects of poor oral health. Hormonal changes during pregnancy can make gums more sensitive and prone to inflammation, a condition sometimes called pregnancy. If this progresses to periodontitis, it can have serious consequences. Studies have linked severe gum disease in pregnant women to premature birth and low birth weight. The theory is that the inflammation and bacteria can interfere with fetal development or trigger early labor. So, for all the expectant mothers out there, taking care of your teeth is also about taking care of your baby. And let's not forget about rheumatoid arthritis. This is an autoimmune disease where the body's immune system attacks its own joints, causing inflammation and pain. What does this have to do with your mouth? Well, researchers have found that the same bacteria that cause periodontitis can trigger and worsen the inflammatory response in people with rheumatoid arthritis. In fact, people with gum disease are significantly more likely to have rheumatoid arthritis, and their joint symptoms are often more severe. Treating the gum disease can sometimes even lead to an improvement in arthritis symptoms. So, what's the big takeaway from all of this? Your mouth isn't isolated from the rest of your body. It's a complex ecosystem. And when it's out of balance, the consequences can ripple outwards and affect your long-term health in profound ways. Heart disease, stroke, diabetes, respiratory infections, habandamantia. The list of potential complications is long and serious. This isn't meant to scare you, but to empower you. Knowledge is power, and understanding these connections is the first step toward protecting your health. The good news is that preventing these problems is surprisingly simple. It all comes back to the basics we learned as kids. First, brush your teeth twice a day for 2 minutes each time. Use a soft bristled brush and fluoride toothpaste. Don't just scrub back and forth. Use gentle, circular motions to clean every surface of every tooth. And don't forget your tongue, where a lot of bacteria like to hide. Second, floss every single day. I know. It's the one thing everyone hates to do. But flossing is non-negotiable. It is the only way to remove plaque and food particles from between your teeth and under the gum line where your toothbrush can't reach. If you hate traditional floss, try floss picks, interdental brushes, or a water flosser. The best tool is the one you'll actually use consistently. Third, see your dentist regularly for checkups and cleanings, usually every 6 months. Your dentist and hygienist can spot the early signs of gum disease when it's still reversible. They can also perform professional cleanings to remove that stubborn tartar that you cooey and get off with a toothbrush at home. Think of it as preventative maintenance for your entire body. Your diet also plays a huge role. Limit sugary foods and drinks that feed the bad bacteria in your mouth. Instead, opt for a balanced diet rich in fruits, vegetables, and whole grains. Crunchy fruits and vegetables like apples and carrots can even help clean your teeth as you eat them. And of course, drinking plenty of water helps rinse away food particles and keeps your mouth hydrated. So, the next time you're tempted to skip brushing before bed because you're too tired, remember what's at stake. It's not just about a bright smile or a fresh breath. It's about your heart, your lungs, your brain, and your overall well-being. A few minutes of daily care can have a massive impact on your quality of life for years to come. Your health is your greatest asset, and it all starts with a healthy mouth. Take care of your smile, and your body will thank you for it. Thanks so much for watching. If you found this information helpful, please give this video a thumbs up and subscribe to the channel for more health insights. Let me know in the comments if you have any questions or if there is another topic you'd like me to cover. Stay healthy, and I'll see you in the next video.